right? So tonight we want to talk about alcohol, the silent sperm killer. It's important we talk about this because I've taught us before how to produce precious sperm. So now you know how to produce precious sperm. Hey, MSEG is here. Thank you, MSEG. Good to see you. Happy New Week. Good to see you. You're welcome. So we've taught you how to produce precious sperm. Now, I need to tell you there are things that can kill sperm. Silent killers of sperm. So we'll start today with alcohol. How does alcohol do so? Right? And this is a habit that nobody suspects. Right? Nobody suspects this one. And that's why it's silent. Alcohol. Right? Now, you know, in conversations about infertility, alcohol is really the first thing to suspect. You say, there is low sperm count. Oh, there's issue with semen analysis. Nobody's suspecting alcohol. It's just there. Right? Most couples will look for explanation for medical diagnoses like hormonal problems, blocked tubes, infection, or even genetic issues. When it comes to infertility, they keep looking everywhere, but nobody's looking this direction, right? Because alcohol, on the other hand, is socially accepted, right? Right? When you see somebody who indulge in alcohol, you really don't, apart from those ones that fall into the gutter, right? But there are those who call themselves social drinkers, right? You really don't raise an eyebrow. It doesn't really matter. Hello. I can't pronounce your name. I'll see Sana. Good to see you. You're welcome. Right? So alcohol is socially accepted. In many cultures, it's even part of celebrations. In fact, if you have not served alcohol in certain climes, you've not started the celebration, right? Right. It even serves as a social bonding and relaxation, refreshment, right? That people use. And because of this, it affects the effect rather it has on male fertility are often underestimated. Nobody looks in that direction. Why? Because in our social gathering is there, in our celebration is there. Socially, we accept alcohol, so nobody is looking in that direction when it comes to infertility in men. Let me reduce this sound a little. Okay, good. Right? But again, remember, in reproductive medicine, we are beginning to look in that direction. We are beginning to recognize how important this alcohol consumption is when it comes to fertility, right? Because alcohol can quietly sabotage male fertility long before it becomes obvious that there's a problem. You see where the problem is. Long before you begin to recognize there is a problem, alcohol has already sabotaged you. And it is one of the most overlooked contributors to the declining sperm health around the world. Remember that in the past 10-20 years, sperm production has cut down 50%. And a lot of people are asking why. This is one of the whys, right? Throughout this week, we will deal with all the whys, right? But tomorrow, we will quickly look at gender selection with respect to why is it that some people seem to only have a particular gender. Female, 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 female. Male, 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 male. What is the fact? What is responsible for all that? You don't want to miss tomorrow, I tell you. Tomorrow is going to be loaded. So let's deal with alcohol matter first. Now, Just to buttress further why alcohol is a silent killer, all right? Um, one of the reasons is that it really have an immediate impact on fertility, right? Right? It works slowly, and in its work, it interferes with biological systems that are responsible for sperm production, that are responsible for hormone regulation and sexual function. All these many things alcohol does quietly, slowly, and is long coming. It's not immediate. And now these disruptions often is gradual. The impact is not this year, is not next year, but gradual. And that's why it's making it very difficult to notice that he's doing something anyway. A man can still feel healthy. He may still have normal sexual function. He may still ejaculate normally. But inside the reproductive system, alcohol may silently be altering the environment that is required for sperm production and development. So that's why this guy called alcohol is a silent sperm killer. And we had to look at it because all of us accept alcohol, right? We do. But if you are trying to conceive, this information today is for you. You got to be careful and you have to learn what we are telling you tonight. So how does it disrupt hormones? It does. It's actually a hormonal disruptor, right? See, understand that male fertility depends heavily on delicate hormonal networks, right? Starting from what goes on in the brain down to what goes on in the testicle. It's a delicate hormonal network and interaction that happens, right? So this system from the brain down to the testicle controls the production of testosterone and it signals the development of sperm, right? But when you indulge in alcohol, what happens? Alcohol interferes with this system in multiple ways, some of which I will tell you tonight. But at least you know now that alcohol interferes with this system, right? First, alcohol can suppress the release of the hormone from the brain that affects sperm production. I don't want to mention the name so that you not get confused, right? Just understand the concept, right? Understand the concept. So where is the first place that alcohol gets to mess up? Your head. It messes up your brain. And that's where your sexual function starts from. Whether you're a man or woman anyway. But I'm concerned about men for now. Sexual function starts from here. And when you take alcohol, it begins to mess up with that delicate hormonal function that starts from the brain. Right? Because these hormones naturally, right, and normally they'll stimulate other organs to produce hormones that would serve for reproductive functions that are critical for reproduction. Like you hear things like LH, FSH. I don't want to bother with all that. But yes, men too have hormonal issues. It's not only women that have hormonal issues, right? So these hormones are the ones that signals the testes to produce testosterone and sperm. They do. Ivy is here. Hello, Ivy. Good to see you. How was your day? You're welcome. Good evening. Right? So these hormones signal, the hormones from the brain, right? They signal the production of testosterone and sperm. They do. Francis Chooks, thank you for the shares. Thank you. All right. So when alcohol disrupts these signals from the brain to the testicle, sperm production declines. Sperm production declines. So that is the first thing that happens. Right? If you're here and you understand anything I just said, type understand in the comment section. We're talking about alcohol being a silent sperm killer. Please talk to me in the comment section that I need to know you are here. And if you know a man that needs this information is not here, share the live to him. Right? Share it. All men need this information. All. Right? All men need this information. So let's look at the other thing. Right? Thank you, Don Lagsy, for the follow. I'll follow you back. Right? Let's look at testosterone reduction. Right? Because testosterone is what makes men men. Right? When you hear men day, that is testosterone you're talking about. Mama, you hold on with your question. I'll get to you when I'm done talking about alcohol and sperm, right? So calm down. I'll get there. Now, testosterone is essential for normal sperm production. For sperm to be produced, testosterone is essential. No testosterone, no sperm production. But alcohol interferes with testosterone. Alcohol does. And it does so in two ways. Alcohol does. And it does so in two ways. Firstly, it reduces the activity of some of those cells. I don't want to mention all that. So just understand the concept. So it reduces the activity of the cells that support sperm production. Right? The cells that support testosterone production, alcohol goes there to reduce the activity. In other words, if that activity is reduced, what happens? Testosterone production reduces. Secondly, alcohol will increase the conversion. Testosterone makes men, right? And also help sperm production. Now, this is what happens. Alcohol now goes there, increase the conversion of testosterone into estrogen. Hold on. I thought estrogen is a female hormone. Of course, there's estrogen in men, but in little quantity. But alcohol, as you continue enjoying your thing, whether you're social or you're heavy, whatever you are, you're taking alcohol. That's what I'm talking about. Right? So alcohol goes there, increase the conversion of testosterone, which makes you man, and increase sperm production, converts this to estrogen, which is a female hormone. Oh boy, it's very funny, but that's what happens. So when that happens, sperm production goes down, right? This means that alcohol can simultaneously lower testosterone levels and increase estrogen levels in men. You've been trying to conceive for 6 years. All right, I'm sure you need some information that will help you, right? Don't worry, stick around. You will learn something. Right? So when testosterone drops, sperm production often will decline as well. So anything that affects testosterone production will affect sperm production. And that is what alcohol is doing, messing with your sperm production. All right? All right. So just think around. If you've missed anything we've talked about from the beginning of this year, all the episodes are on YouTube. Go search there, Dr. Godwin EMB. Search my name there. All the episodes are there. If you watch it long and hard enough and do what we ask you to do, you'll be pregnant. No mistakes about it. You will. You will, because these are practical information that will help you. Some of you are just wasting your time, and some are working in ignorance. And I'm here to cure your ignorance so that you carry your baby, right? Now, besides the influence that alcohol have on hormones, it also has it damages the testes directly, right? It can damage the tissues responsible for sperm production directly. Alcohol. After today, some people will just remove alcohol from their mouth, never to return to it again. Chemical pregnancy, oh, don't worry about that. Just relax. Just stick to the information we give you. You'll be fine, right? Just stick around. Are you following me yet? You better do. If you're here, you're not following me, you want to follow me now, right? Because there's so much information I have for you this year, and I'm thinking by the time we are done with you this year, there will be cries of baby all over the place, right? We've already have a lot of people pregnant, so your turn is coming. Your turn is coming. All right. So that's why I'm taking 1 month to deal with men. When I'm done with men, I'll go to women. Right? We'll go to women. So for now, we're halfway done with men. And by the way, tomorrow, if you miss tomorrow, you miss too much. We want to find out why is it that some men have girls, or boys. Why? We're going to answer that question tomorrow. So stick around tomorrow. So I was saying that alcohol have direct damage. Right. Good evening. Christy LaBelle is here. Hello, Christy LaBelle. Good to see you. You're welcome. Right. All right. So the direct damage alcohol does to sperm, right? To sperm production. Now, inside the testes, what you have are structures that produce sperm. I don't want to give you all those details. Don't worry about it. Just understand the concept, right? Now, when you consume alcohol in the long term, remember, alcohol does not affect you immediately. It's long time coming, right? So when you consume alcohol or you are exposed to alcohol for a long time, it may cause degeneration of the areas that produce sperm cells. That's the first thing. It may impair sperm maturity. Now the sperm cells have been produced. Now, what is supposed to make it mature is no longer available because alcohol is impeding it. Right? And it can also reduce sperm output. Now listen, if you are a man, you're trying to conceive, you want to pay attention to the things we are going to say in the next 15 days, because it may just change your story. Because some of you are just wasting your time. Right? You're just wasting your time. So long-term exposure to alcohol will degenerate the cells, the area that is responsible for sperm production. It will impair sperm maturation and also reduce sperm output. In fact, in severe cases of chronic alcohol abuse, the testes themselves shrinks. As in, you know what atrophy is? The testicles atrophies. That's what alcohol does. Right? You see somebody say, "Oh, I don't understand. My testicles are looking smaller." Of course, they are looking smaller. You are abusing alcohol, right? So you're causing it to atrophy, right? So that is the direct damage it can do, right? That's direct damage. Now let's talk about oxidative stress. I've talked about this over and over and over and over again. So let's talk about it. It's one of the most important mechanism through which alcohol will damage sperm. This oxidative stress. Oxidative stress. Now, when you consume alcohol and alcohol is metabolized, what happens is metabolized means it's broken down in your system. And while you're feeling high and you are forgetting your problems, you are causing more problems because people have claimed that the reason why they indulge in alcohol is because they want to forget all their problems. Well, while you are forgetting that one temporarily, maybe is work that's giving you problem, maybe it's your spouse that's giving you problem, maybe it's your family. While you are forgetting their problem temporarily, you are permanently damaging something down there, right? So you want to be careful which one. Better stay with your spouse, quarrel the quarrel, but leave that place because in the end it makes everybody happy, right? So I said all that to say that when you consume alcohol and it is broken down, the product that is produced when alcohol is broken down in your system, um, they are harmful molecules, right? And those harmful molecules, we call them ROS, right? We call them reactive oxygen species. Don't worry about the name, right? They are harmful, and this molecule will damage the structures, right? That is responsible for sperm, in fact, sperm structure basically. For example, sperm membrane, the the very thing that brings energy in sperm that makes it swim very fast, it damages it. And even DNA will fragmented because of these ROS. Why? Because every time you consume alcohol, the alcohol is broken down into something. And that something is ROS. And ROS damages all these things in your sperm. I wonder why you've been knocking for many years and it has not produced results. I'm showing you now. So be careful with alcohol. Is that okay? You got to be careful. You have to be careful because excessive oxidative stress like this will lead to reduced movement, that is motility. We talked about that a few last week, right? Reduced motility, abnormal morphology, that is the way it appears. You see sperm appearing abnormal. Sperm that is supposed to look in a particular way is having no head, two heads, small head, big head, short tail, abnormally appearing that way, and those ones cannot fertilize nothing, even though the sperm count is normal. So it's not enough to say, oh, the sperm count is fine. No, you are looking at beyond the count. What is the quality of sperm? Is that okay? If you're here, talk to me. Do you understand anything I just said? Talk to me. Talk to me. Type understand in the comment section, then I know you are there. So when sperm is affected this way, the chances of fertilizing anything is lost or reduced. Is lost or reduced. Right? Because unless the sperm meets the required shape, the required quality, it will not fertilize any egg. If you like have 1 billion sperm cells, if it does not meet this criteria, it's not going to fertilize nothing. So you gotta be careful what you do with alcohol. And like I would say, whether you are a social or non-social drinker, it does not mean anything. Alcohol is alcohol. It is metabolized and it produces harmful molecules that damages sperm. Full stop. Right? All right. Thank you very much, Ivy. I appreciate you. All right. So now, having said all that, what is the impact of alcohol. Aibo is here. Hello, Aibo. Good to see you. What is the impact of alcohol on sperm count? Does it have an impact? All right, if you're here, you're not following me yet, you want to follow me now. You want to follow me now, right? The reason is because of what I'm going to talk about tomorrow. Is that Esther Masere? Esther Masere, please confirm you're here. Hello, Aibo, you're welcome. Right? Tomorrow, we want to find out. Esther Masere is here. Nice to see you. Tomorrow, we want to find out why is it that some men can only have girls, even if they have 3 baby mamas. All the 3 baby mamas, girls. Some men can have boys. If they have 4 baby mamas, all the 4 baby mamas, boys. Why? What's responsible for this? I'm sure you're interested. Don't miss tomorrow, right? Don't miss tomorrow. But now I'm done with you this year. Of that overpopulation will become a reality. So don't let them say there is overpopulation and your own has not been added. It's not going to work, right? All right. Let's go back to the gist. So that's why I want to share the live and tap on your screen. Not for me, but the people who are trying to conceive. Tap on your screen. Let's make babies, right? All right. So let's go back to the gist. The effect of alcohol on sperm count. Yes, that's what I'm going to say. Studies on studies upon studies have shown that heavy alcohol consumption is associated with reduced sperm concentration. I'm not the one that said it. People have researched it and it has been reported. Right? Alcohol consumption has been associated to this. One time, among us guys, of course, we know that when we go out with our friends and you are among your friends, you are the one that does not take alcohol. Everybody's ordering alcohol and you don't. They look at you like, oh, come on, this guy is a Jew guy, right? Well, I want to be the chairman of Jew guys. Why? Because I want to produce more sperm cells, right? The Jew guys are having babies. Why the machos are not? All right. So where was I? We were talking about the effect of alcohol on sperm count. Effect of alcohol on sperm count. And I said there are studies that have shown that there is an association between heavy drinking and low sperm count. Men who drink heavily, right, produce fewer sperm when you compare to those who don't. So, team no alcohol, just wave at me in the comment section. Even moderate drinkers sometimes reduce they show reduced sperm counts. Hello, POG is here. Ivy, are you a man? Oh boy. So I was saying that even moderate drinkers can sometimes have a reduced sperm count, right? When you combine other factors like lifestyle stressors such as smoking, poor diet, or even sleep deprivation. All that put together can, right? But the focus is on alcohol. So that you're a moderate drinker, you're not out of the hook yet, right? You're not out of the hook yet. I learned a lot on your live stream, doctor. The problem is you don't have time. Oh, sorry. Sorry. Don't worry. You will have time. Is that okay? You will. Remember what we said. We said for one sperm to be produced, it takes 70 to 90 days. Right? 70 to 90 days. So the effect of alcohol, alcohol exposure, the effect may appear several months after you have consumed it. So the problem of sperm you have today may just be the 3 months ago alcohol you consumed. The same way we talked about heat, the effect of heat on sperm. Be careful. And I tell you, by the time we are done in the next 15 days, we'll have more healthy men, healthy sperm all over the place. And that is the goal. Produce precious sperm, right? Precious sperm. So that is on that, the impact of sperm count. So heavy drinkers show low sperm count, low sperm concentration. Even though you're a moderate drinker, there is other factors that adds to your moderate drinking that will affect sperm concentration. Is that okay? So alcohol, the effect of alcohol on the ability of sperm cells to move. Movement problem. Can alcohol cause movement problem? Right? Or if you are still here, please tap on your screen, share the live, talk to me in the comment section. Just type I'm here. Let me know you are here. Then we'll continue. Is that okay? All right. T Square Edibles is here. I see you. Now, you know that for sperm to move, the ability for sperm to move, it will depend heavily on how healthy the part of the sperm that produces that energy, that's the middle part, how healthy it is, right? Because that is where the energy for movement is produced. Is that okay? So when you have when you consume alcohol, there is the alcohol induced oxidative stress. Lady G is here. So this oxidative stress that is induced by alcohol damages that part of the sperm cell that makes it to move. Trouble, right? So when the energy supply is weakened, what happens? Sperm movement becomes sluggish, become inefficient. Just if you're trying to conceive, leave this alcohol thing. Long story short, because we can keep going and going and going. There's a lot of problems that alcohol causes. Because in the end, this can dramatically reduce the likelihood that the sperm will ever reach the egg. Remember, what does the female uterine tract does? It removes all the sluggish sperm, remove all the dead sperm, remove all the dirt that come with it, remove all those that are abnormal. Now you're using alcohol to, you have good, your sperm count is good, but there's problem. They can't move fast. So what does the woman's uterine tract does? It sieves out all those sluggish. So whose problem is it? It's your problem. It's actually not the woman. What does alcohol do to the morphology, the appearance of sperm? What does it do? Alcohol does a lot. So on the appearance, it actually affects or influences the shape and structure of the sperm. There's a way sperm should look, and if it's not looking that way, it's not going to fertilize anything, right? So if you are supposed to have an oval head and you are coming with a round head, nature quality assurance system will remove that abnormal appearance, and production of sperm is influenced by alcohol. So you're either going to be having sluggish sperm or abnormal looking sperm, because during sperm development, alcohol exposure may interfere with that complex process that brings about the head, neck, and tail. Then you are now having sperm cell that looks like let me not say it. Right? So alcohol makes it look abnormal, and if it is abnormal, it's not going to fertilize anything. Is that okay? So that's what we were saying in a nutshell. Beyond that, alcohol also damages DNA in sperm. DNA damage in sperm. Right? Lovely Ifechuku is here. Good evening. You are welcome. Good to see you. Right. So if you are still here, make sure you're tapping on your screen. You're sharing the live. Let us hit 10K. These days, I'm not talking about the likes anymore, because it's not. Thank you very much for the heart, me. Just tap on your screen. Let other people who are trying to conceive see us. That's the only reason why you should tap on your screen. Otherwise, just sit down, grab your pen, and enjoy your life. For real. For real is here. Right? You know, this DNA damage is perhaps one of the most concerning effects of alcohol on fertility. Right? DNA damage in sperm. You know, I remember I told some people one time when we were having the discussion about taking alcohol and stuff like that. And I said, if you just give me, one good thing that alcohol does, I will be the chairman of Alcohol Consumers Association. Right? But for that one good thing, I have 1,000 things that alcohol does wrongly to you. So that's where the problem is. It does worse. I think it just make you high, forget about your problem temporarily, and also make you want to knock. That's all. Apart from that, I don't see what it does. I don't see what it does. So now the many bad things it does is included in is also DNA damage is also included in it, right? Why? Because you see that head of sperm is rich in DNA. Basically, that's what it carries. Right? It carries half of the genetic material that holds the instruction that is needed for creating a new life. Right? So when you consume alcohol, what are you doing? You are instigating alcohol-related oxidative stress, which will go to those DNA and break them down within the sperm. Break it down. They begin to wonder, why are we? No, you are not conceiving. Even when you conceive, there is a, what do you call it now? Miscarriage. Even when you were able to give birth to the baby, there is abnormality. Why? What is I'm telling you, right? Even if there is fertilization, DNA damage may increase the risk of these things I'm going to mention. So write it down. Even if, right? Even if you dodge miscarriage, so you better have the miscarriage actually, right? So even if you miss the miscarriage, what happens? You're going to have failed embryo development. You're going to have Of course, miscarriage I just mentioned. You're going to have reduced embryo quality. If all this will lead to pregnancy failure, but if it doesn't, then you're talking about abnormality that you see all over the place, right? So you want to be careful. So, long story short, alcohol may influence not only the conception but also the health of your developing embryo. Alcohol, right? So even if you are doing your best to have a healthy pregnancy, what does the doctor say to women? What did they say? Do not consume alcohol because of the impact on the embryo, right? So these are the medicine. You cannot know this thing and you still balance in the bar and be ordering. Why are you like this? And you're trying to conceive. I cannot help you after this. All right, so all that we've said, alcohol does. Besides that, alcohol also has effect or impact on erectile function, right, and sexual performance. Maya said they do dorime. Yes, they do. But again, at what cost? At what cost? Right? Alcohol can also affect sexual function. Right? In the early stages, consume alcohol, you want nap because you're high, right? You know why? Because small amount of alcohol will actually uh, uh, reduce inhibition, right? And it will increase your perceived sexual desire, make you want to nap. Small amount. But when you consume in excessive consumption, what happens? It impairs the performance. That's why eventually such people will now be looking for enhancement, right? Most people basically that are indulging alcohol, the first thing you notice is that alcohol and desire to knock is 5 and 6, right? But as you make progress, it begins to impair your sexual performance. So what do you want to do now? You want to either take more alcohol or go and get other enhancements, monkey tail, also call it burantashi, and all those manner of things. Because I was saying that heavy drinking can cause erectile dysfunction. Heavy drinking can cause reduced libido, right? Reduced libido. Heavy drinking. When he was not drinking so much, he wants to knock, but now he's drinking so much, he's not even interested in knocking. And in your mind, you say, don't go knock for outside. Not necessarily so. Right? So heavy drinking also can delay ejaculation. Miscarriage. Oh, sorry about that, Gypsy. Sorry about that. I'm very sorry about that. You are okay? Sorry about that. But I'm sure you are all right now. I'm sure you're okay. You're okay? I'm sure you're okay. If you're okay, it's fine. Let's look forward to what's coming next. Thank you very much for the Rosa Ivy. Thank you. So I was saying that heavy drinking can cause erectile dysfunction. Heavy drinking can reduce libido. Heavy drinking can delay ejaculation. Right? And delay ejaculation. If you're trying to be pregnant, you will get pregnant. Just make sure you understand the things we are saying. Right? So I said all that to say that all these things I just mentioned, these problems may reduce the frequency or effectiveness of intercourse during the fertile window. Yeah, okay. Gypsy said, I don't know why it doesn't stay more than 5 weeks. It depends on many things now. If you have been coming, you should understand that by now. Depends on many things. We want to look at age of couple. We want to look at lifestyle. We want to look at stress management, sleep, and all that. So don't worry. When you come up, you talk to me, so we can direct you, we can guide you. Is that okay, Gypsy? Now, I've been hammering on alcohol, especially those that say they are social drinkers. I love it when they say so. They just want to dodge. They look for a way to dodge from the gist. But there is a hidden problem of social drinking. You know that many men assume that fertility problem only occur in heavy alcoholics. That is the assumption. But today I'm not going to spare you. I'm not going to spare you. It's not only for them. Because studies, research have shown that research actually suggests that regular, moderate drinking can influence sperm quality in some individuals. Sperm quality. So whether you're a social or you're a non-social drinker, so long as there's a drinking in the equation, you will collect. So men who drink daily, even in moderate amount, may experience subtle normal changes, right? An increase in oxidative stress. You already know what oxidative stress will do to sperm. And by the way, remember, the drinking today will manifest 3 months time. The problem today came from 3 months ago. Be smart, right? Be smart. And social drinking or whatever drinking you do have an accumulative effect over time, especially when other factors combine, which they always do. Right? They always do. So you want to know whether you're social or non-social, you are in the gist, right? So before I take 1 or 2 questions tonight, today is pretty short because tomorrow is going to be very long. I want to know why some people is only girls they can produce and some is only boys they can produce. Tomorrow is going to be long. I will make sure I eat plenty food. You know, there are several lesser known aspects of alcohol effects on male reproduction. These are not things you just hear anywhere, but they are. First, alcohol may alter the composition of seminal plasma. Seminal plasma is actually the fluid that supports and protects sperm. Sunshine baby, good to see you. How are you? All right. What did I say? Remember the other day when we were talking about precious sperm? I said even if you are not trying to conceive, at least when you receive the semen, it is beneficial to your body. There is minerals, there is vitamins, there is protein, there is hormones that you benefit from. But now, look at what alcohol is doing. It alters the composition of the seminal plasma. What should protect the sperm and benefit you, right? So that's the first thing. The second thing, chronic alcohol use can impair the place where sperm is stored, the epididymis. Yeah. So much so that the structure where sperm mature and gain motility is damaged. Because when sperm is produced, it is stored somewhere. It is in that store that it is trained out to be matured. it is trained how to swim. Now the store is being damaged by alcohol, and you expect to have quality sperm. It's not going to happen. You are the cause of the problem. That is the second thing. The third thing, Tosco Arts. I'll follow you ASAP. The third thing, alcohol may disrupt your sleep pattern. We all know that. Right? And which indirectly affects testosterone production. We already know. If you don't sleep properly, adequately, sperm production will be impaired, and alcohol distorts it. But I want to ask those of you that you indulge in alcohol. I wish I do, but I don't have any reason yet. Right? Why is it that alcohol is sweeter at night, into midnight? Why? I want to know. Oh, sunshine baby, good. I want couples to listen to us. So, people that take alcohol, I want to know, why is alcohol is sweeter at night and into midnight? Talk to me. So, when you are supposed to be going to bed, that's when you are doing dorime in the bar. You know, this indirect effect, right, will further compound the damage to your sperm health. You're gonna. All men should produce precious sperm. All men should. Is that okay? So I'm sure we understand up to this point. Talk to me in the comment section. If you understand, type understood. But I want to bring you good news. Right? I want to bring you good news. Before I give you the good news, please, if you are not following me, you want to follow me now. Right? You want to follow me now, and make sure you're following me down to YouTube, because all the past episodes are there. Please watch the video and subscribe. Right? Subscribe. Let us grow there too, so that we can help more people. Right? So where was I? I said I want to bring you good news. Marie A, good to see you. You're welcome. Good news on this matter. You know, it's all about bad news. Sperm, alcohol will do this, alcohol will do that, alcohol will do this. Bad news all the time. But I want to bring you good news. And the good news, yes, let's hear good news. In fact, let's dance to it. All right. Now, the question of the good news that we're going to answer is, can fertility recover after stopping alcohol? Did you hear that question? Can fertility recover after stopping alcohol? See, the encouraging news in all the gist tonight is that male fertility often will improve when alcohol consumption is reduced or stopped. I told you, 9 out of every 10 problems with male infertility are reversible, unless the person was born that way or there's a genetic problem. But every other male infertility problem can be reversed. But the problem is, men don't come for this kind of gist, and they don't usually go to the clinic to be helped, right? So majority of the problem men have with fertility is ignorance, nothing else. Ignorance. Otherwise, there's no problem anywhere. Just adjust. So I was saying that the encouraging news is that the male infertility can be often improved when alcohol consumption is stopped or reduced, if you cannot stop it, right? But I prefer you stop it, right? Because Sperm production occurs continuously. It's not like women that were born with all the eggs that they ever have. If anything happened to that egg from the time of birth, it has happened for life. Right? But look at men every day, sperm production. And I told you the other day, every second, 1,500 sperm is being produced. And I've been sitting down here for, let's say, 1 hour 30 minutes now. Right? So in 1 hour 30 minutes times 1,500 per second, imagine how many sperm cells I've produced. If by the end of today, I would have produced over 100 million sperm cells. Right? Right? So men produce this thing back to back, back to back. So because of that continuous production, new sperm cells can develop under healthy conditions once the harmful exposure is removed. So if you stop your behavior of alcohol today, from tomorrow, quality sperm cell begins to be produced. Quality. That's why I tell you, if you will change your attitude today, in 3 months' time, all you will ever produce is precious sperm all the way. Right? So improvement in sperm quality may begin to appear approximately 3 months. 3 months, which will correspond to the sperm production cycle. Right? In 3 months. Right? So calm down. Do the right thing and you'll be all right. There's really no problem anywhere. For those who are heavy drinkers, it may take a little longer because of the long-term damage. But it does change. It does improve. And that is why last year, part of the things I was teaching last year was learn to prepare your body. You're trying to conceive. If you're trying to conceive, learn something. These are not the things they will tell you can pay millions of naira. They will not tell you that in your consultation. But I'm going to tell you for free, right? Right? You want to conceive? Prepare your body 3 to 6 months, and you almost never go wrong unless there is a serious problem somewhere. Why? Because the quality of egg and sperm that will be available by that time will give you the result you are looking for. So that's why I want to advise couples that are trying to conceive. Right? Reduce alcohol consumption, because that can be a very powerful step towards improving your fertility. I know couples who indulge in alcohol together. Right? The husband is taking 2 bottles, the woman is taking 2 bottles, right? So the two of you, hold on. Stop for now. Let us produce the baby, then you can go back to your bottle competition. So you see, men that are trying to conceive, the things you want to benefit from will be you want to limit or eliminate alcohol intake. Lady G said Ogogoro family. Right? So what men are trying to conceive, what they will benefit from, you want to either eliminate alcohol or limit it, reduce it tremendously. Right? Improve your diet. I'm just saving you. I'm saving you I don't know. Just listen to what I'm telling you, basically. Right? Improve your diet and eat food or fruits that are rich in antioxidants, right? Maintain healthy weight. Sleep. Get adequate sleep. Reduce your stress. All these things I just mentioned, these are natural support that you can give to your sperm development. And more often than not, people who have done them have come back to testify that that thing you said, I'm now pregnant. So what are you waiting for? Better if you don't listen, you'll pay to listen. Right? You will. You will. Anyway, so let's take some questions. But before then, I just want to say that when you ask the question, why are you not pregnant? The answer sometimes lies within these areas that people least expect. And that's why I bring it to you. Rarely is there a disease that is causing you not to conceive. Rarely, in my experience. All right. And more likely, thank you very much, Ebony Classic. Good to see you. You're welcome. Really, some things are just achievable if you have knowledge, right? Some things like some of your problems is just in your everyday habits. You know, somebody one time came to of course, I consult virtually, right? I consult virtually. So the person came and I said, okay, from what I've seen in your results, this, and this, don't do it. In 3 months' time, let's talk again. I said, no way. I thought you were going to give me drugs. You were looking for drugs. Why? Because the average human being thinks that for their problem to be solved, they need drugs. I can do that. But is it really drugs you need? Is it really drugs you need? I'll leave it there. I'll leave it there. So in the mind of that individual, you have not done anything for them that is worthy of pay. but when you give them drugs, now you are talking. Hello, African Queen is here. What country are you? I'm in Nigeria, right? I'm in Nigeria. Good to see you. You're welcome. All right, so if you are not following me yet, you want to follow me now. Your solution to your fertility challenge is here. By June, you go collect, right? And if you don't conceive by June, by December, everybody that has been listening would have collected and will go and rest. Then we'll start all over again next year, right? All right. So send your requests, come up, let us begin to answer your questions. If virtual consultation is available, I can always consult with you online, right? But it's $50.